Hello, I'm Nancy Desjardins, and I'm sitting beside Dr. Dharam Kaur, and she's a naturopath. She's a naturopathic doctor here in Owen Sound. And believe it or not, I've been living in Ontario all my life, and I've never been to Owen Sound. And Dr. Kaur, this is a beautiful place.
It is a beautiful place on the Niagara Escarpment. Yeah.
And you've been here all your life?
I've lived here for about 14 years, but I grew up not far from here. Spent all my summers at Sauble Beach, which is about a 25-minute drive from here.
Wow, that's amazing. So Dr. Kaur is the author of 3 books. The first one is the Healthy Breast Program Workbook. And I remember I did borrow this book from a very good friend of mine. And the other 2, which I have in my library, is the Complete Natural Medicine Guide to Breast Cancer. Every woman should have a copy, an amazing book for breast cancer preventive and also treatment as well. It talks about everything, which we're going to talk about during this interview. And the latest one is the Complete Natural Medicine Guide to Women's Health. And this is her latest book that she wrote. And again, her name is Dr. Dharam Kaur. I'm having a really hard time pronouncing her last name, but her name, but it's Dr.
Dharam Kaur.
Okay, good. She's pronouncing her name much better than I am. So Dr. Kaur, what inspired you to write those, the books on, well, especially the book on breast cancer?
When I was still a student at the Canadian College of Naturopathic Medicine, one of my friends who lived in the same house as I was diagnosed with breast cancer. And I guess I was in my 3rd year, and I watched her try to integrate naturopathic strategies with conventional treatment for breast cancer, and how difficult that was for her. And I coached her a little bit through her process. And she passed away shortly after my first child, was born. And so that time was an incredibly emotional time, profound time for me. And after her death and after I graduated, I started to work with women with breast cancer as a naturopathic doctor, and started to assemble a series of workshops that would help them be able to learn how to live in a healthy manner, either to prevent the disease or to overcome the disease. And that then grew into the first book.
But 20 years ago.
It was 20 years ago, actually. Yes, it was. I graduated in 1989. So.
Wow, that's amazing.
Yeah.
And just going back, like in last November, I did a 1-hour interview over the phone, and that was the theme, breast cancer. And one of the first questions I asked you was, that was coming from your book that you mentioned Netherlands, United States, or rated the highest. Like, this is where we found the most breast cancer.
Yes, the breast cancer is most predominant in the industrialized nations. The Netherlands and the United States.
Canada, we're not too far.
We're probably number 10 or something like that, but are the 2 highest places in the world. And so there's a whole combination of factors, dietary factors, lack of sunlight, lack of exercise, not as many children, having children later, high-fat diets, too much meat, etc. There's a whole host of factors that contributes to breast cancer. It's never just one thing, And we have to look at all of those factors to be able to reverse the epidemic and to help a woman recover and prevent recurrence.
Yeah, I'm sure, absolutely. And also you mentioned that in your book that women whose mother were diagnosed with breast cancer before the age of 40 has about double the usual risk themselves.
Right. There's a number of profiles that causes a doubling of risk of breast cancer. One is to have a mother or a sister, if those 2 people were, or if either of those was diagnosed at a fairly young age. The other is if you've been on the birth control pill between the ages of, any time before age 20, so say 18 to 25. If you're on the birth control pill for 5 years, and you started before you were age 20, then there's a doubling of risk. If you had an early onset of menstruation, so if menstruation happened at age 10 instead of age 13 or 14, and if you have a late onset of menopause, so say menopause is age 54, and that increases the estrogen, the estrogen receptor, and that increases the estrogen, the estrogen receptor, and that increases 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 the estrogen receptor, load during our lifetime, that also doubles risk. So there's a whole number of factors that double risk.
And all the research, I mean, you've done all the research on this fact. Yeah. That's amazing. So what about if the amount of children that we have, this also, will this contribute?
The greater the number of children, the less risk of breast cancer, particularly if you have children early, like before age 30. And ideally, it's the opposite. Ideally, you want to have your children in your early 20s for preventing breast cancer, which is not so practical these days for a lot of young women. But part of it is that our breast cells only mature completely after you've given birth.
That's right.
Not when you're pregnant, but after you have a full-term birth, and then the breast cells are more stable, so less likely to become cancerous once they're more stable. So if you have a child when you're 19, 20, 21, 22, 25, etc., that'll decrease your risk for your whole life because the breast cells are more stable at a younger age. Also, breastfeeding, the more we breastfeed, that also decreases risk. Part of the reason, unfortunately, may be because we're downloading or dumping the environmental toxins we've stored from our lifetime into the first child with breastfeeding. So we decrease those chemicals that in us could cause breast cancer. Unfortunately, we pass them on the next generation, which is then why we're seeing breast cancer occurring in younger and younger women, because they have a higher toxicity level than their mother did at that age.
But you still encourage people to breastfeed their child, but perhaps remove the toxicity stored in factors.
So one of the things I'm really passionate about is that we can eliminate over 90% of our lifetime body burden of environmental chemicals with about 150 hours of sweating.
Exactly.
So either using an infrared sauna or a lot of exercise. And so I encourage young women to do that before they're even 20, you know? So at about starting in their teens to start doing an hour or two in a sauna. And then before they think of having children, tally up and get their 150 hours done. And then maintenance after that is about 2 hours a week in the sauna. But that way we won't pass on this environmental load to the next generation. And it's not only causing breast cancer, it's causing infertility, it's causing ovarian problems, it's causing learning disabilities, thyroid disorders, autism. All those diseases are what's implicated are many of the environmental chemicals that are hormone disrupting or that mimic estrogen.
So 150 hours. So so you're like, as far as the sauna, what kind of sauna?
You know, it doesn't matter that much, but the infrared sauna is certainly more comfortable. What matters in terms of cleaning the body is simply that you sweat.
Okay.
But with an infrared sauna, you sweat at a lower temperature, and you can stay in for longer, and there's no risk with infrared saunas with people with heart disease, whereas with some of the other saunas that are at higher temperature, the regular electric sauna, there can be a difficulty with women with heart disease, and menopausal women certainly don't want to go into the higher heat sauna.
No, exactly.
So the infrared is great because you sweat at a lower temperature a lot.
We're sweating this morning here. No, it's very hot and humid, by the way, so we don't need the infrared sauna today. So, but we're actually, by the way, sitting in, the interview is at Dr. Kaur's office in Owen Sound, by the way. And but you do have the infrared sauna here in the office.
I do actually. So just in the room back, we have an infrared sauna. The company Sauna Ray from Collingwood helped us set up the sauna. It's sort of custom built, but we're using their heaters. Okay. And my sauna fits about 6 people, which is really nice. And what I love about my infrared sauna is that I can lie down in it and go to sleep.
Oh.
So a lot of people have very small infrared saunas that you have to sit in and claustrophobic for an hour. But in fact, when I was writing my books, I would be getting very little sleep, and I would be falling asleep as I'm trying to write. And I would just say, okay, time for my nap. And I'd lie down in the sauna, sweat for an hour, wake up totally refreshed, and start writing again. It was fabulous. Sure. So it's a great way to de-stress also. And the sauna has a timer, so it turns itself off after an hour, so you can't hurt yourself. Yeah.
They have those new sauna with a television and a radio. And
oh, no.
I know, that's right. That defeats the purpose. You want to relax.
It's quiet time. I've never seen it.
Okay, so that's,
I think that's ridiculous.